Good morning, everyone. I'll be presenting Man vs. Bee on behalf of Medicine 5. Starting with the case scenario, Mr. K is a 41-year-old gentleman from Vellore, presented with multiple bee sting around 4:30 p.m. on 3rd of November. So around 4:30 p.m. he's a farmer. When he was walking in his farm, he sustained multiple bee stings in the face, bilateral upper limbs, and the trunk. After that, he developed hives, itching, and lip swelling, and he was taken to a local hospital initially and was given treatment for the same, after which he had some improvement. He did not have any breathlessness, no giddiness, chest pain, palpitation, no loss of consciousness or seizure. He was referred to CMC in view of lip swelling for further management. So he came to CMC, he was fine for a while, and he was observed in CMC ED for 6 hours. And around 2:30 a.m. in the ED, he developed a deviation of angle of mouth and right hemiparesis. He did not have any LOC or seizure or did not have any other complaints at that time. So past history wise, he did not have any other comorbidities, not an alcohol consumer or a smoker. So on examination wise, his vitals, BP was 120/70 millimeter of mercury, heart rate of 82, saturation of 98, respiratory rate of 18. Even when he had this right hemiparesis, his vitals were normal, did not have any shock or anything. On examination, he had lip swelling, he did not have any hives. On CNS examination, his speech was, naming alone was impaired, otherwise he did not have any other issues. As per the deficit, he had right human facial palsy with right hemiparesis with a power of 4/5. Other system examination was also within the normal limits. So diagnosis, he had a multiple bee sting presented with anaphylaxis, an acute stroke syndrome with right human facial palsy with hemiparesis. So we went ahead with the investigations. HB initially was 17.1, which improved to 14 after hydration. WBC count was 26,700, neutrophil of 93. He did not have any other organ dysfunction. And MRI actually showed that done at the time in ED, acute infarct in left putamen as well as in the frontoparietal region. MRI was normal. In view of within the window period, he was given tenecteplase 12 mg and shifted to what? So my diagnosis is acute stroke syndrome due to multiple bee sting. So I'll be talking about this bee sting resulting in the stroke. So coming to the article, so this bee sting, this bee belong to the species of Hymenoptera. They contain plenty of peptide toxins, which results in the release of histamine, serotonin, and phospholipases, which result in the vasodilatation, vasoconstriction, which causes the lot of multi-organ dysfunction as well as a stroke as well as acute coronary syndrome due to this bee sting. So in a review of 26 cases of bee sting, they have documented the presentation as well as the age involvement as well as the male to female ratio of the stroke presentation in the bee sting. So the stroke onset is usually between 15 minutes to 14 days, the mostly within half an hour to 1 day. And in the age range of 1 to 71 years, males are more frequently involved because their outdoor activity is more. The presentation is usually hemiparesis, dysarthria, seizures, involuntary movement, and altered consciousness. So this is the literature review where they've mentioned the stroke presentation after bee sting. Here we can see that the most of the onset of deficit are within 1 hour and within 1 day. And they and most of them have a hemiparesis, with some having a cerebellar sign, seizure as well as the paraplegia. So coming to the mechanism for the bee sting, so mainly because of the, as I mentioned earlier, because of the histamine, tryptase, and the phospholipases, which result in the organ involvement. If it is involved, the skin hives will be present. Respiratory system, they can have laryngospasm resulting in breathlessness. Gastrointestinal, they can have this loose motion and as well as the other complaints. Cardiovascular, they can have Kunis syndrome presenting at myocardial infarction. CNS, they can have stroke, hemiparesis, seizure as well as the paraplegia. So this is the mechanism of stroke they have mentioned in the bee sting. So one is this immune system hyperfunctionality, release of excessive cytokines, which further potentiates the release of vasoactive amines, resulting in hypoperfusion of the cerebral blood flow. And another thing is there is retrograde stimulation of the superior cervical ganglion, which is actually in control of the sympathetic nervous system, which will further potentiates the hypotension. And another mechanism they mentioned is sometimes the bee sting can actually activate the disseminated intravascular coagulation, so which can also cause the stroke they have mentioned. So this is the same mechanism that I put resulting in the stroke. One is mainly due to systemic vasodilatation, hypotension, and direct CNS vasoconstriction secondary to the bee venom. And third one is the blood clot formation due to DIC or platelet aggregation. So these are all the presentations of the bee sting. It not only causes the stroke, it can present with acute myocardial infarction. It can cause DIC. It can cause last month in Medicine 5, there was one patient who presented with rhabdomyolysis followed by ARDS as well. So we've seen patients present with acute myocardial infarction. They can present with the Geisbach syndrome. There was one encounter where the patient in India, more than almost 500 bee stings all throughout the body, and it resulted in death as well. So these are all the presentations of the bee stings. So coming to the risk factors per se, they have noticed that the patient who have baseline high serum tryptase, basal high serum tryptase, which will actually potentiate the release of histamines as well as the other vasoactive amines, or they have clonal mast cell disease, they are more prone to develop the severe reaction, or they are at a very old age, or they have a previous bee sting resulting in severe systemic reaction. Also, they have mentioned that they can present with severe reaction. So one more indicator is their absence of urticaria and angioedema, which they have mentioned that they have high baseline mast cell activity. So because of that, they usually do not have this urticaria or angioedema. They are also at risk of developing this severe reactions. So commonly, the thing we already know is that stings in the head and neck area is usually causes severe reaction. But in this article review, they mentioned that the stings in the head and neck area usually doesn't cause the severity of the reactions, mainly because of the baseline tryptase as well as the mast cell disease or the previous history of severe reaction. So I just wanted to, so one more thing is, can this severe reaction be prevented because patient came immediately ED and we are giving hydrocodone adrenaline? So far, there are no evidence saying that the early administration of hydrocodone or adrenaline can prevent Kuhn syndrome or other severe systemic reaction. So they have the baseline risk factors. They are prone to develop the systemic reaction. So my summary would be, some multiple bee stings can present as a stroke, and they can have various manifestation including ARDS, rhabdomyolysis, as well as other organ manifestation, and also the mechanism and the risk factors for the severe reaction secondary to multiple bee stings. Thank you.
Thank you, Dr. Brightlin. Can I ask you a question? Did this patient have persistent deficit or it improved after?
It improved after tenecteplase. When he left the ward, he had 5/5 powers, sir.
In your hypothesis of why it creates, whatever data you showed, vasoconstriction, vasospasm was one, clot is another.
Another one.
How did you determine whether this patient had a vasospasm or a
So
clot?
we did carotid Doppler and the other embolic workup. He did not have any other thing. PT was also on the normal range. So
but we had given tenecteplase
emergency itself, yes, sir.
So I'm asking, would it have improved even if we had not given?
Possible, sir. He could have had a vasospasm which could have improved after the simple hydrocodone, sir.
Any other questions?
What? Sorry, I missed the age. What is the age of the patient?
Age is 41, sir. Our patient age is 41.
Any comorbid?
He's did not have any diabetes, hypertension, not a smoker or alcohol consumer also, sir. He did not have any baseline comorbidities.
All the other case series, do they have any underlying atherosclerosis which bee sting could have superadded on that?
That I'll have to look, sir.
There's something to look at. As I just pointed out, I mean, you're asking a question, did you have a good reason for thrombolysis in this patient, or could we have watched symptomatically to see whether the person?
So we could not immediately find the multiple mechanisms. He could have developed clot. He could have developed this vasoconstriction. It could be a simple vasospasm, but we didn't want to take a chance, so we went ahead with the thrombolysis.
So clot formation would be, this was a unilateral.
Unilateral, yes.
Clot formation. So you are talking about clot in a normal vessel. Your basis is there. Have they demonstrated clots in previous studies? Difficult to demonstrate as they did. They would have done an angio. They just did a
stroke protocol alone. So MRA did not show any. Didn't show any. MRA was actually normal. No stenosis, no atherosclerosis, nothing, sir. No cutoff or anything.
So very empirical.
Yes,
any other questions? Anybody online? Any questions? Thank you, Dr. Brightlin. Good presentation. Next, could we have Dr. Amrita?